Hello everyone. So welcome to PG Daily Dose. So consistency beats motivation. So small daily efforts lead to big results. Let's tackle today's MCQs. So the first MCQ is a 6-year-old boy presents to the OPD as shown below. Identify the false statement regarding the condition. So as you can see the image, this is the condition. Option A is it is a choristoma. Option B, it is lined by stratified columnar epithelium. Option C, it is commonly located at the infratemporal limbus. Option D is it is associated with Treacher-Collins syndrome. You may pause this video and think about the answer. So let us move on to the answer. Option B is the correct option. The false statement in this question, because the condition here shown is it is limpal dermoid. Okay. So it is limpal dermoid and it is lined by stratified squamous epithelium. It is not lined by stratified columnar epithelium. So what is this condition? As you already know that limbus is the junction between cornea and sclera, and dermoid is often non-cancerous, that is benign cyst which is having a congenital origin. Okay. So this limpal dermoid, it is having a congenital origin and it is a congenital benign tumor. It is classified as choristoma. Choristoma is nothing but it is a normal tissue in abnormal location. So the first option is correct. It is of course a choristoma. So most commonly it is seen at the infratemporal limbus. So that is also correct. Okay, it is commonly located at the infratemporal limbus. So next is it is often associated with the systemic syndromes like Goldenhar syndrome and also Treacher-Collins syndrome. So that is also correct. So the incorrect statement here is it is lined by stratified columnar epithelium. So it is lined by stratified squamous epithelium. Okay. So what is Treacher-Collins syndrome? Treacher-Collins syndrome is nothing but it is a mandibulofacial dysostosis. It is a genetic disorder affecting the first and second brachial arch derivatives. So these are the features, that is eyes with a downward slant, small and flattened cheekbones, small steepy ankle jaws, and also small oddly shaped ears. So this is the other pictures of this limpal dermoid. It is often seen at the infratemporal region, limbal region. So I guess this question is, yeah, you got this question. The second question is, a 6-month-old infant presents with recurrent otitis media and persistent diarrhea, poor weight gain, and also immunodeficiency is suspected. Okay, which of the following investigation is best initial screening test, okay, in the evaluation of this child? So the option A is serum levels of IgG, IgM, IgA, and IgE. Option B is a complete blood count with differential. Option C is peripheral T cell phenotyping. And option D is erythrocyte sedimentation rate. You may pause the video and think of the answer. Let us move on to the answer. Option B is the correct option, that is CBC with differential. Because why CBC? Here we already have this detailing, that is immunodeficiency is suspected, right? So CBC can detect with differentials can detect lymphopenia, neutropenia, eosinophilia, and also thrombocytopenia. Okay, so it can detect lymphopenia, so it can detect which can suggest of a T cell or a combined immunodeficiency. Neutropenia can suggest of a phagocytic disorder, and eosinophilia can suggest of a hyper IgE syndrome. It is philia. Okay, so it can suggest of a hyper IgE syndrome or any parasitic infections. Okay, and thrombocytopenia can be suggestive of a Viscott-Aldrich syndrome. Okay, so and also it can be taken as a primary investigation because it is cheap and it is also widely available, and it can detect all these disorders in one go. So why not the other answers? Because the first option is IgG, IgM, IgE detection. So it is useful for antibody deficiencies, but it may not give an idea of a T cell or a phagocytic problem. And here in question, it is a 6-month-year-old infant, right? So what happens is that the method IgG is still present. So the interpretation will be much trickier. Okay. And the phenotyping is of course an excellent test, but it is often considered as a second line, or it is a confirmatory testing after an abnormal screening test is present. So and another drawback is that it is too specialized, so it is often considered as a secondary or a confirmatory testing. Okay, then ESR is not at all specific, so it is not a non-specific inflammatory marker, and it is not useful in diagnosing immunodeficiency. So that's why option B is correct, that is CBC with differential. Next question is, a 5-year-old boy while having dinner suddenly becomes aphonic and it is brought to the casualty with the complaints of respiratory difficulty. Okay, and what should be the appropriate management? First is intubation, option B is emergency tracheostomy, option C is humidified oxygen, option D is Heimlich maneuver. So yeah, you can pause for the answer. Let us move on to the answer. The option D is the correct option, that is Heimlich maneuver, because here two detailings is present, that is the child becomes aphonic and also respiratory difficulty and while having a dinner. So some foreign bodies have been obstructing the airway, right? Yes. So what happens is that and also this Heimlich maneuver is performed so that it can dislodge the foreign body immediately without wasting the time on an invasive procedure. So that's why it is an immediate response, like Heimlich maneuver is more considered here in this situation. So why not intubation? Because the tube cannot pass beyond the obstruction. Okay, and it can also push the object further deeper. And why not tracheostomy is often considered as a last resort. So then humidified oxygen, it is useless if the airway is mechanically obstructed. So Heimlich maneuver, you already know the procedure. This is the Heimlich maneuver procedure. Upthrusting of the abdomen just above the umbilicus, inward and upward motion is performed so as to like foreign body can come out. Next question is, a 32-year-old woman with a history of diabetes presents with a 3-day history of a painful lesion. This is the lesion as shown in the image. What is the diagnosis? The first is folliculitis, option B is furuncle, option C is carbuncle, and option D is erysipelas. So yeah, you can pause. The answer is furuncle, or it is also known as boil. Okay, this is the image of a furuncle. Yeah, this is. So furuncle, why furuncle? Because it is a bacterial infection. What is furuncle? It is a bacterial infection involving a hair follicle. Okay, and it is a painful red swelling around the follicular opening, and it may often progresses to an abscess. So how to know the lesion? It is red. It is a firm nodule with a central pus filling core. Here in detail we can see this is the pus filling core, and it is often a necrotic one. A pus-filled core, that is a necrotic center, is often present. It involves the dermis and also subcutaneous tissue. So it is much more deeper. It is not a superficial one. So, and why not a folliculitis? So here in this lesion, it is red. It has a central pustule or a central core of a necrotic core. And it is painful. So just understand the lesions. Okay, we can also move on to the other lesions. Why not folliculitis? Folliculitis is often like a pimple-like thing. Okay, the lesion is often a pimple-like because it is small. It is red, tender papule or pustule like a pimple. Okay, it is centered on a hair follicle. Then it is a very superficial. Okay, and it is having a mild pain. And why not a carbuncle? Carbuncle is the joining of many furuncles. So it is having multiple pustular openings. Okay, it is large, deep, interconnected abscesses with multiple draining sinuses. As you can see, there are multiple draining sinuses. Is that clear? And it will be having severe pain. And it is often associated with diabetic patients. So erysipelas is not at all a follicular infection. Yes, so it is most commonly seen in face and lower limbs. It is bright red, sharply demarcated, raised, warm, tender plaque. Not an infection of follicle. It is having a burning pain and tenderness. So just know about each and every lesions, so that with the image itself you can like get the correct option. Next question is, a 41-year-old male presented with shortness of breath. The following radiograph was taken. What is the most likely diagnosis? Option A is large pneumothorax. Option B is pulmonary embolism. Option C is Poland syndrome. Option D is pleural effusion of the right side. So guess the answer correctly and let me know in the comment section. We will discuss this question in the next day, 7 p.m. Thank you everyone. Be consistent for your NEET journey. Thank you.